And for more now, we're joined by Dr. John Brownstein, Chief Innovation Officer at Boston Children's Hospital. Welcome, Dr. Brownstein. Thank you so much for being with us this morning. A new report estimates that Omicron could spread 2 to 3 times faster than Delta. That is extremely concerning. What could that mean for Americans as we are already seeing those cases rising?
Yeah, I know this is a lot to take in, Janae. Good morning. We have this recognition that this variant is spreading faster than any other variant before. Millions of cases will come in the next few weeks. So there's an urgency to double down on interventions. Vaccinations are still our best weapon. Boosting if you're eligible. If you're gathering or traveling, testing. Remember, a test that takes 3 days to turn around is not going to give you accurate information because the incubation period for this variant is only a couple of days. So you need to get that information immediately. But now it's not the time to be complacent, even though I think with all these tools, we can still have a safe holiday season.
And that is reassuring to hear, but there is still that report that estimated the risk of being reinfected with Omicron is more than 5 times higher than the Delta variant. So what does that tell us about the risk of the Omicron variant?
Right. I think this reaffirms what we initially believed, that the immunity to previous variants may not provide the same level of protection to this variant. And this is why we're going to see a rise in reinfections and breakthrough infections. We don't know the severity of this variant. We see some data that it's mild, but we just don't have enough information. Vaccines are still going to protect against severe illness. And again, boosters are going to play such a big role right now.
And Dr. Brownstein, now the CDC is allowing schools to use this test to stay protocol. So that's where the unvaccinated kids and staff exposed to COVID-19 can test instead of quarantining. Obviously, that keeps kids in school, takes the burden off of parents. The guidance follows studies out of California and Illinois. But what should parents and schools know about this practice? You just said that the testing time, it takes 3 days to turn around.
Right. This is really important information. This is why, there's such urgency on implementing these tests correctly. But this far in the pandemic, we need to get our kids in school. It's super important that they remain in school and only quarantine or isolate if necessary. My kid's school has been using this for months and it's worked incredibly well. I think we have the tools that we need right now between masking, social distancing, and vaccines in our kids. We have what it takes to keep our kids in schools right now, in addition to this test and stay program.
But of course, really quickly, I have to ask you that these studies were done before the Omicron variant was spreading here. Should that affect how schools implement the test to stay?
No, I think, again, we have what it takes, between hand washing, masking. This is just one tool in our arsenal. And since those studies were done, kids became eligible for vaccines. So we have a lot more to protect our kids, but we just have to be more vigilant about exposures and try to use those rapid tests as much as possible if you think your kid was exposed.
A lot to keep in mind, Dr. Brownstein. Thank you so much for joining us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.